Great. Thank you, Fiona. And I'm also going to ask, just because it just makes it easier when our presenters are speaking, if we can all have our mics muted and cameras off. There'll be an opportunity to ask questions at the end of the presentations, but before we get there, if it's okay with you all, if you could just keep yourselves muted with cameras off, that would be great. Okay. Um, One last thing before I introduce Ikamva Labantu. At the end of this, please keep your browsers on. A feedback form will automatically load on your browser when you come out of this meeting. Please complete the feedback form. We really value the insights from this audience because you are the kind of the bulk of the ELOM audience, and we really want to make sure that we are having conversations that are adding value to the work that you do. So please stick around for a little bit and fill out the feedback form at the end of this hour. Okay, without further ado, I would like to introduce Ikamva Labantu, represented today by Mildred Bopoto and Barbara Stemmert. Ikamva Labantu is a non-profit organization that works throughout Cape Town's township communities. Sorry. Throughout Cape Town's township communities with the holistic and community-led approach to the sustainable development of impoverished communities, with the focus on ECD, the well-being of older persons, and after-school initiatives for children. Ikamva is also one of our repeat partners. They've done ELOM studies, several ELOM studies, including one that they're currently about to go into the field for Endline. So without further ado, Barbara and Mildred, take it away.
Good morning, everybody. Thank you so much, Rumbi, for having us here this morning. I'll just give you a quick rundown of the organization, and Mildred will dive deeper into the learning program quality assessment. So Ikamva Labantu has been around for over 60 years, and as Rumbi mentioned, we focus on early child development, child, youth, and parenting, and older persons. Specifically in our ECD department, we focus a lot on training. We train the practitioners, we train principals. We also focus on the registration of ECDs as well as now after-school programs. Our older persons department has a focus on club-based for our more able-bodied older persons, and our Umulwani program focuses more on our frail seniors. Our child, youth, and parenting department focuses on after-school programs. We also do a partnership with another organization where we prepare youth for tertiary studies, and we also do parenting training. So a brief history about our learning program. So Ikamva Labantu reworked the work within the world of ECD, and we then developed a learning program that was then registered back in 2014 with the Department of Social Development. The content of this learning program aligns with the National Curriculum Framework as well as NALS. The content is divided according to age groups from 0 to 18 months, 18 months to 3 years, and 3 years to 5 years. We train 60 practitioners a year, and we then divide.
Sorry, Barbara, sorry to interrupt you. Do you mind just setting your presentation in presentation mode? It's
Oh, so sorry.
no worries. Thank you. Okay.
Mildred, you skipped. There we go. So sorry about that, everybody. So as I mentioned, we train 60 practitioners. We then divide them according to the age groups of the learning program. And Tabita, that's part of the webinar today that's listening, she's the key trainer. We have a three-pronged approach. The practitioners attend 2 days of theoretical training at our center in Khayelitsha. So alternating every second week, they come in and then they go through a certain aspect of the learning program training with Tabita. And then they attend one in-house practical training session a month at our Kwakanya Educare. It's a site of best practice. It is where practitioners are then supervised by our practitioners and guided in terms of how they implement the various aspects. And then we also offer on-site support. So every month, our community-based workers go out to each site and then problem solve with a practitioner in terms of how to implement the learning program. Because as you all know, in township communities, they struggle with space, they struggle with limited resources. That's all from my side. Mildred's going to take you through the rest. Thank you.
Morning, everyone. I'm Mildred Bopoto. So now I'm going to actually present on the ELOMs, Learning Program Quality Assessment. Okay, so our journey began, we identified the need to evaluate the impact of the learning program. So this brought us to the ELOMs, as it is the only standardized tool in South Africa. So in late 2024, we assessed 5 educares, including our own educare of best practice using the ELOM tools to evaluate the learning program quality and the developmental status of 75 4 to 5 year olds. Our experience is first-time users. So we had to outsource local assessors so that we could reduce the costs because they were local. So their transport cost to the ECD centers was minimum. And these local assessors are Xhosa speaking because our community is predominantly Xhosa speaking community. So the assessor that we outsourced for the 4 to 5 year old assessment was a male and unknown to the children. And we also had a female assessor who actually assessed the learning program quality assessment. So the mentoring and on-site support concluded 2 years ago. So these are the practitioners that were on our training 2 years prior to the assessments, which impacted the continued learning program implementation. So we gave the principals feedback on the results that we had actually received from data drive. Because of the gaps that we also identified, we had to encourage the principals to support their practitioners with the learning program implementation. Due to limited classroom space, resources may not have been within view of the assessor because, you know, our community ECD centers are very small and the space to actually lay out the learning program areas, they are very limited. So sometimes when the assessor is in the classroom, won't be able to see all the resources that are in the classroom. In the absence of a baseline assessment, we were not able to measure progress or lack thereof. Our aged care was assessed individually. So we're talking about our best practice aged care, and the learning program findings did not correlate with the children's developmental performance within the 5 domains. Why are we implementing the learning program quality assessment in 2025? So we wanted to fully understand the impact of the learning program training. To fully understand the impact of the learning program training, we required a baseline and endline assessments. In 2025, we increased the sample size of the educators to 10. Remember, we started with 5 in 2024, but the results were not really, you know, the smaller the sample size, sometimes it impacts on the results. So we had to increase from 5 to 10, and the children remained 75, just like in 2024. So we want, currently in 2025, we want to review the adjustments made based on the 2024 findings to the learning program training methodology. We want to determine how this impacts the practitioner's implementation and the children's development across the 5 domains. So recommendations for change. An assessor should be introduced to the children informally before the actual assessment so that the children get used to the assessor. You know, when you bring a stranger, sometimes it actually scares the children, or sometimes they don't really feel free to perform to their optimum best. And then another recommendation, we also reported to Data Drive our concern about not having a measurement of children with their relational quintile. So you find the children that are in advantaged ECD centers or educators compared with the children that are in the disadvantaged communities. So if we can have an overall assessment with the results for the national or provincial, but we also need results that actually reflect the different quintiles. And then emphasizing gross motor, emergent literacy, and numerous activities in the training. So our training, we found that there were gaps, especially when it comes to gross motor, because this emerged from the learning program quality assessment that this wasn't done regularly in educators. So we need to emphasize that in our training, including the literacy and numerous activities. Also observing a classroom from 8 in the morning to about 12 p.m. so that one can actually fully see what's happening in the learning program. Because 2 hours we felt will be quite short, and you miss a lot of things that actually happen in the classroom when it comes to maybe peer engagement, like child-to-child interaction and practitioner-child interactions. Okay, and then we have a message to the users. Assessors, please be mindful of not disadvantaging the low quintile educators by not being mindful of the context. As I mentioned earlier on, you get into the classroom, which has very limited space, and then you only see maybe a few toys displayed. Then you think, okay, there isn't enough resources in this educare, and yet maybe some resources are stored somewhere, and then they are only taken out when there's need to use them. Okay, that's us. Thank you.
Thanks, Mildred and Barbara. Thanks. I think you've painted the beginnings of a picture about why the LPQA is important to use alongside with the child outcomes, that you're mapping what you're looking at in the learning program. So in a classroom observation to what's happening with the children who are in those classrooms. So that is, I think it's a particularly valuable takeaway, and we'll talk a little bit more about it at the end of the presentations. So thank you so much for sharing that with us. Thank you. I'm going to go on now to introduce Thusanang. Thusanang means to help one another, and the Thusanang Trust is a non-profit organization based in Limpopo. It has a core focus on the well-being of the young child, and the majority of the activities are conducted through community-based ECD centers where they reach communities through practitioners, committees, and parents. We're very privileged and grateful to have Terry Morgan from the Thusanang Trust to talk a little bit more about what Thusanang does, and also the way that Thusanang has used the LPQA tool, which is different to the way Ikamva has used it. So I'm going to hand over to you, Terry. Thanks so much for being here.
Thank you. Let me just try and share the screen. Okay. So Thusanang is an early childhood and community development NGO. We are based in Bopoto, Limpopo. Our vision to create a sustainable environment for the development and well-being of young children is achieved through building the capacity of ECD practitioners, primary caregivers, and community stakeholders. I'm now only going to talk to the interventions that we have with the ECD centres. So we've used the LPQA as one of the tools to measure the impact of our work in one particular project, which is the ECD cluster project. This is a 3-year project where we're working with 304 practitioners from 67 ECD centres. We did a baseline at the beginning of the project, which was early last year, and we completed the midline assessment in July this year. We need to make program decisions that are based on solid evidence, and therefore we need to measure the outcomes of our work. The project involves training 60 practitioners for the level 4 qualification, running regular workshops on the theme of the month and other workshops that we discover we need, providing regular demonstration and mentoring at each centre, as well as providing educational consumable resources. We also train the supervisors and members of the parent committees. The baseline findings were presented initially to our staff and then again at stakeholder meetings, where the supervisors, members of the parent committees, and community leaders were present. The midline results provided a really good comparison with the baseline. So the way they presented is so user-friendly and works so well to be able to see the differences that we've made. We repeated the process of presenting the midline to our staff, and we'll be sharing it at the next stakeholder meetings. So unfortunately, we haven't got results yet of how they felt about all of that. We also received separate results for each ECD centre, and these are currently being shared with the centres. So the results have shown us where there are any shortfalls in our interventions and what we should concentrate on for the next period. It's also great to be able to share with the practitioners and supervisors so they can see the progress that is being made. We're fortunate to be working in the same schools for 3 years, so have a good opportunity to make change happen. Everyone involved knows what the objectives of the project are, and the expected outcomes for children. The project area is far from the office, so all planning is done from the office. It therefore works for us to have more communication happening between Data Drive and the office rather than directly with our assessors. The way that the results are presented is very, very user-friendly and shows clearly where there are improvements and what gaps there are. We did have a few challenges. We had to start we had to get our midterm evaluation on the entire project out to our funder. So it was a little challenging having a delay in starting with the midline assessments. Now that we're clear on what the requirements are from Data Drive, I think the end line should go a little bit more smoothly. And we also had some ECD centres dropping out and others joining. So there were a few differences in the centres. So we reduced the numbers to ensure that the midline was done at the same place as we had done the baseline. It was just unfortunate that we could not always get the same assessor doing the starting, what do you call it, the starting one and the midline. So it was sometimes a different person, which is not ideal. It really ought to be the same person. I'd say for anyone else using the LPQA, I'd say that your assessors, once they've been trained, they must have regular team meetings to ensure consistency of assessments. Especially if you're doing a lot of different assessments and using a lot of different assessors, I think it's important that they're all on the same track and all measuring the same thing. So our question now is to assess if all of this leads to improve child outcomes. We'll be doing the ELOM 4 and 5 assessment with a sample of children from some of these ECD centres at the beginning of next year, and then again at the end of next year. So we're hoping that's really going to give us a really good picture of what we've been doing over what will then be the 3 years. And that's us. Thank you.
Thank you. Thanks so much, Terry. Thanks for sharing that. Um, I want to just kick off the question section with a question for you, Terry, before you mute. Um, what was the motivator behind scheduling this as a multi-year study? So I know that with child outcomes, we usually do baseline and endline within the same period. But with LPQA, you can stretch that out. And I'm wondering what the motivation for stretching it out and making it multi-year was for Thusanang.
Okay, so because it's a 3-year project, we thought we were going to get sort of the best idea of how we're going if we did a baseline showing where we were, and then the midline of the project where you haven't done everything you want to do yet. So how much have you been achieving? And then also to know, with still time before the end of the project, to know where you needed to make improvements, what was working, what wasn't working. So it was really just to assess how the project was going. Okay, it is quite an extended period, but we were doing other little assessments obviously throughout the whole time. But that just gave us a formal assessment that we still have time to work on before the project ends.
And can I ask what other assessments have you been using in the course of the project?
These are just our local in-house assessments. So our trainers just go there and they have, they record what they're seeing, what they've worked on, what they're expecting to see next time. If there's any improvements the next time they go and visit, has the practitioners done what was expected of them? We also, within this program, we're also doing the formal level 4 qualifications. So that is also running alongside all of this. So it's a multi-tool thing. Yeah.
Yeah. Okay. Thanks. Mildred and Barbara, I wanted to just check what your experience has been of integrating what you're learning through the LPQA and also the 4 and 5 into your own measures of quality. I know that in conversations that I've had with Mildred, and I think you alluded to it, that you've had some surprises when you've got your ELOM data back. And so I'm wondering, has that impacted how you integrate the ELOM tools into your own monitoring and evaluation? What does that look like at Ikamva?
Okay. So for us, we actually looked at our training methodology to try and improve, especially both the learning program and the children's development. So because what we discovered was, especially with the ECD centers that we actually train, if the learning program is not being implemented optimally, we can't expect the children to actually develop as we expect, because what is put in is what must come out. So if we put in rubbish, then we'll get rubbish out as well. So we actually have decided now, because within our control, as I mentioned earlier on, we in 2024, we actually assessed people that were previously on our training. So support was no longer there. So this year we decided it's better we actually assess people who are currently on our training. So we started with the baseline, so that at least from what we actually got from 2024, we can put measures in place, because the 2024 results actually highlighted some gaps in our training. So with the methodology, as I said, we had to actually put the assessments to the people that are currently on the training, so that at least whatever we want to change, we can start implementing with the group that is currently on the training, so that by the end of the year, we can see if these interventions that we've put in place are actually working. And also, with our training, we provide a kit of toys. So this kit of toys we normally give to the practitioners around July, August, because of the dropout rate. So we don't want to give them at the beginning of the year, because when they drop out, they go with the resources. So what we have actually started doing earlier on in the training, say the first month of the training, we put them through a session for making toys from scrap. And this continues throughout also the training period, so that at least we actually upskill them to actually make toys from scrap, so that they don't say we don't have funds, so the children don't have toys.
Okay, thanks, Mildred.
And then also the other thing, sorry, Rombi, we have discovered that we actually give our trainings, and I'll say an overview of the learning program. So we'll actually facilitate how to do a morning ring, how to do storytelling, but the nitty-gritties of what happens with the storytelling and what happens in the morning ring, we have not been really emphasizing that. So now we want to drill down to the actual activities that are supposed to happen in each and every, activity. Can be morning ring, storytelling, so that at least, because now they know, of course, the morning ring, I'm going to implement it like this, but how do I actually associate it or relate it to the topics that I'm actually facilitating?
Sure. I see there's some questions that have come in, but I have one follow-up for you, Mildred, before we go to the questions in the chat. How have you communicated the results of, or have you communicated the results of the baseline ELOM 4 and 5 and LPQA with the practitioners? Have you communicated that, and if so, how?
Okay, the answer is yes. We have communicated the results. So we would have an overall report to the or feedback to all the ECD centers. So what we'll do is like block out the names of all the participating ECD centers, so that at least there is that confidentiality. And then from there, so just show them the results across. And then later on, we'll call individual educators now with their name visible to actually show them, okay, so the people actually say, oh, so that was me. Maybe they did very well, or something was kind of lacking, because when they see the overall report, they'll say, oh, this one did better than this one, but they don't know who it is. Then when you actually give individual feedback, now they actually say, oh, this was us. And then there'll be a discussion also on how to actually, because we didn't just give to the practitioners, we called it the practitioner and the principal, because we want the principal to actually know what is happening in the classroom and how they can actually support their practitioners.
Thank you. Thanks, Mildred. Marie-Louise Samuels has a question. Would you like to unmute yourself, Marie-Louise, and ask your question?
Hi, thanks very much, Terry, both for you and Ikamva for the presentations. I just was interested to know what was your dropout. You indicated that you had some of the centers dropping out. So of your initial 67, what are you left with now? Thanks. Thank you very much.
Thank you.
Marie-Louise. No, we had, I just lost my earpiece here. So we had 67 that started, and then we had one that dropped out. Well, it was all for different reasons, but it was one was because the school, the children couldn't get to the school, so the school had to close down for a while until they can rebuild. Another one didn't want to be a part of the program, and one was a playgroup. So it was just too small to run as a normal ECD. So, and then another school that that we had somehow not found joined us, had been wanting to join us. So we said, well, no, we're full. And then when we had the dropouts, we said, okay, fine, then you can come into the program.
Great. Thanks, Terry. Fiona has a question. Would you like to ask your question, Fiona?
Thanks, Rumbi. I'm just to give a bit of context, so I'm part of a project where we're considering implementing both ELOM and LPQA for a group of ECD centres in a specific geographic area, but they're all using different kinds of learning programs. So this is thinking about a baseline, obviously, before we start working with them. So I'm interested with both partners, despite the fact on the one hand, I'm understanding you've been giving them a lot of support before implementing the LPQA. So I'm wondering if there's any similarity between the learning programs, but I'm interested to understand for both partners if there was variation in the type of learning, not just the quality or the effectiveness, but is there a variation in the type of program that the centres are implementing, and are you able to kind of get a view, therefore, by implementing LPQA of whether a particular or any of the particular learning program approaches is more effective than others? I hope that makes sense.
Thanks, Fiona. That's a great question. Terry, would you like to take it? I think Ikamva might have dropped off. Oh, they're back.
Okay. Yeah, well, so we had not been working with those ECD centers before. So when we came in and did the baseline, it really was at the beginning of the whole program and our interventions with them. So there's no kind of comparison between programs, because we came in, as I said, we hadn't worked with them before, and then we started working there from there. So they've all been doing the same thing. So yeah, so that's, if that answers your question.
Okay, from us, I think also there's no comparison because we are assessing people that are on our training. So the training itself is on the learning program, and so everyone is implementing the same learning program.
Okay, that's useful to know. Magali has questions. Would you like to unmute yourself, Magali?
Thanks. Yes, good morning. My questions were specifically about the gaps that you identified based on the LPQA findings. I'm talking about gaps in your program or your training. I'm interested to hear. I mean, you've mentioned some of it, the Ikamva Labantu team, but I'm interested to hear in which of the areas of the tool most of the gaps were coming from, whether it was the learning environment or, learning and teaching, or more the relationships, interactions, the curriculum, or the teaching strategies.
Can I come in there?
Oh, okay.
Okay, all right. Okay, so basically we were just like really, really pleased with the results. We just saw improvement in every single thing. But the least improvement was in observing children. And we have known that this is something that takes time for practitioners to learn to do. And it was just very, very clear that this actually is something that we need to concentrate a lot more on. So observing children and reporting on what they're observing is definitely a shortfall. But we also think that as the practitioners get more experienced and have more training, they will then find this easier to do. But it certainly was highlighted by the results of it.
Thanks, Terry.
Mildred?
Okay, from our side, it was mainly the teaching strategies. Just for an example, when a child is maybe given or tried to give a response or given a correct response, I'm just giving an example. So acknowledging that child was actually lacking in most educators, that's one. And also the use of open-ended resources. So the resource can be open-ended. For example, let's say it's during creative arts. What we have also discovered is children are given templates to actually maybe it can be coloring in, or there's what you call it, the practitioner has a sample of what she wants the children, or he or she wants the children actually to do, without actually giving that autonomy to the children to actually be creative. That was one of them. And also with the equipment, this is now not really only the learning program quality assessment, but also with the 4 to 5 year old. The equipment that the children actually are required to use for the assessments might be foreign to the children. Maybe the ECD centers don't have like bean bags. They are used to throwing and catching balls. but the educator doesn't have a bin bag. So with the ball, children it's a big ball. They use both hands to catch the ball, but if it's a bin bag, they're required to use maybe one hand and then the other one, which is less dominant. So I think also just having a variety of those resources, so that at least when they come to the assessment time, the children are used to this equipment. And also with the emergency literacy, lack of books or reading material in the educators. So for Ikamva, how we actually trying to fill that gap, we have partnered with the Zebra Books, whose actually aim is to provide at least 10 books per child per year. So the practitioner gets a big book that will be actually read in class, and then the children get the same book, but it will be kind of a pamphlet so that they can take home. In our communities, our children don't own books, so which is another gap that we identified. So I think I'm happy to say that at least that one, we are on the road to actually try and cover it, not knowing if reading will be really continue at home, but to encourage the principal to encourage the parents to read with their children.
Yeah. Thanks, Mildred. Shelley has a question for you, Mildred. A really good question that we're also always asking ourselves at Data Drive about the LPQA and the ELOM 4 and 5. Shelley?
Hi, Mildred and Barbara. Yeah, thanks for sharing your learning. I found it so interesting today. I think I remember a slide where you said, I think it said there were not correlations between the LPQA scores and ELOM domain scores. And I'd just be really interested to understand a bit more about that, or perhaps I've misinterpreted it. But if you do have any information about the links between the program quality scores and ELOM domain scores, I'd be really interested.
Okay, thank you, Shelley, for that. So remember, I made reference to the 2024 results. And with the 2024 results, we had 5 educators, of which one was our own Ikamva Labantu educator. So with the other educators, we could see that because the learning program also, they didn't do very well. And then the child assessments also didn't come out very well as well. So there you can actually see that, okay, if the practitioner is not really doing what she's supposed to do, the children won't be able to perform or develop in all their domains. But what puzzled us was, as we mentioned, we have a best practice educate. So our learning program results didn't really correspond with the child assessment results. So which made us wonder, because we have almost everything in place for our educate, but the child assessments didn't reflect what is happening with the learning program. So I don't know if I have answered you, Shelley.
Yeah, that's very helpful. Thanks, Mildred. Thank you.
Thanks for that, Mildred. Yeah, it's a very yeah, I think that's part of what was surprising about your results. Because what you would hope to see is where the learning program quality assessment results are positive, the child outcome results are also positive. I see there's a question. There's a question in here about Fiona. I'm gonna let you unmute yourself and ask your question. That's okay.
Thank you. No, I'm just that whole point about emergent literacy, it's so important. And there seems to be constantly a kind of correlation, both a real correlation and a kind of perceived correlation, perhaps, of the how important it is to have reading materials in ECD centres to promote early literacy. But yet it keeps bothering me because given the fact that, so many practitioners are resource poor, but it doesn't mean that they're not focusing on emergent literacy or can focus on it through the use of effective storytelling and really sort of inventiveness in using different kinds of materials and things to promote storytelling and promote children, even very young children's use of storytelling. And I refer particularly to some work that D.G. Murray Trust did, I mean, probably about 10 years ago now, in the use of a philosophy for children methodology with children as young as 3 in ECD centres, which was all about kind of, well, amongst other things, was about focusing on storytelling using anything, toys, materials that are around, and kind of both getting the practitioners and the children to really focus on the use of language and the use of imagination and all that sort of thing. So when using something like the LPQA, if it's very black and white, i.e. no reading materials equals no emergent literacy, then I find that problematic. So I'd like to understand a bit more about its nuances really in that regard.
I'm going to ask Jess to step in and answer that one.
It's a really great point, Fiona. I
No,
think
yeah, sorry.
can
you hear? Yes.
So the literacy component in the LPQA at the moment, it's 3 items, well, 3 main items with some sub items. And it's not only based on books, it's also based on things like rhymes and songs and conversations and discussion. So, yeah, it's not completely book dependent, but it is kind of predefined indicators of literacy engagement and promotion that get observed by the assessors. So it's quite standardized. So there isn't much room for kind of open-ended interpretation of what a literacy activity would look like in terms of inventiveness, just because, yeah, doing that I think would make the LPQA a bit more difficult and nuanced to administer. So yeah, it isn't just defined as storybooks, it's also defined as talking, listening, conversation, drawing and writing, that kind of thing.
Thanks. I think that's also where conducting that along with the child outcome assessments would be useful, and actually might tell you something in cases where there's a concerted effort to be creative around emergent literacy, where you can actually report on that impact. So that's something to think about. Lee has been very, very patient and has had her hand up for a while. Please ask your question, Lee.
Thank you. Thanks to both the organizations for sharing. Mildred, I just wanted to ask some clarity on your best practice center and the difference between the ELOM results and the LPQA. Was it that the LPQA results were showing well and then the ELOM results weren't showing as well, or was it the other way around?
So the learning program quality assessment showed that most of the things are in place, but the child assessment now, the children didn't do very well.
Okay, thank you. That's just what I wanted clarity on. Thanks so much.
I think this is where we looked at the assessor. And then for 2025, we actually felt that maybe the children were not comfortable with the assessor because the assessor found that their concentration was a problem, which the practitioners in the classroom didn't experience that. We were wondering also, because he was male, were they comfortable to be on their own with him in the assessment room? So this year we changed. We thought we'll get a female assessor. We'll have the assessor visit each site the day before the assessments actually began. She'd play some games with the kids. So at least when she walked in the next day, it wasn't daunting for them to be with a stranger and to engage with a person. So that's where we changed. Another thing we're also wondering in terms of the length of our training, our practitioner learning program training spans over 10 months. And if you really want to drill down into different aspects of the learning areas, we have to go back to the drawing board and look at, can you actually train all that information in 10 months to the practitioners? Do we actually need to extend the length of our training and actually include even more practical opportunities for the practitioner to really unpack their learning?
Thanks. Just a thought on that. I think like this is something, because we've done both at our centers, the ELOM and the LPQA, and like the LPQA is great because it assesses what the center has control over in a sense, so you can really work with your centers to improve. So I'd like some input from Data Drive just on my thoughts on this. And then the ELOM with child outcomes, there's so many factors that influence child outcomes, not just the learning program. And could that be the difference? Just some thoughts on that would be good. Thank you.
Sorry, Lee, you're asking Data Drive's input. Can you just ask what you're asking us again?
So with the LPQA, it's very much assessing the classroom and the teacher's ability in the classroom and many factors within the center itself. And then the ELOM is obviously measuring the child outcomes, which is affected by more things than just the learning program. And so it makes sense in a way that those two things don't always correlate, or should they? So that's my question.
Mm-hmm. Yes.
Hi, Lee. I think it's expected, I suppose, or from a social perspective, that you'd expect that LPQA scores might predict ELOM scores and child outcomes, but you're absolutely right that that expectation can be quite unrealistic in certain settings and inconsistent. So we often don't necessarily find a very strong correlation with quality scores and child outcomes because exactly of the complexity of what goes into supporting child outcomes. So it's always a very tricky thing. And if you are wanting to look at, building a model of child outcomes using quality scores, we offer lots of different controls and some cases. So yeah, I think I wouldn't expect there to be a very strong correlation without doing maybe a more intensive analysis.
Thanks, Jess. There's a question from Erato Nadia. Would you like to ask your question?
Sorry. Yes. Hi. I've been listening and a lot of it has been actually addressed. I was coming in from the language and literacy point, and I know that what Fiona was raising around the storytelling and that discussion really clarified that. So that's great. I'm coming in from being called to do rapid assessments of whether or not ECD practitioner trainings at that NQF 4 level is basically working and how it's panning out. And I just, with all the expertise in the room today, one of the things is to use the tool to assess what's going on in the learning program. But I think from what you're all saying, and I suppose I'm just looking for your thoughts on it, is that without some kind of measure of the children's performance or outcomes, how would you then evaluate the practitioner? Because I think it's a very true thing that a lot of the practitioners, they might do morning rings and they might follow all the things that are required, but it's that critical thinking and that depth of what's actually going on that is the kind of the goal that one has to evaluate. So I suppose what I'm asking you is that, do you see the tool being, when you're assessing the quality of a learning program, would you see that as a correlation with how well or not well the ECD practitioner is trained? I mean, I think it's a very tenuous link in my head, but I wonder what you're thinking from both those organizations.
Can I jump in just
to...
So I hear what you're saying, but I think one of the critical findings that came out of the Thrive 2024 results is of those aspects of the LPQA, the biggest correlation between child outcomes and LPQA results is teaching strategies, which I think points to it's not necessarily an evaluation of the practitioner, but it points to the importance of the training that a practitioner receives. So regardless of the resources that they're working with, are they able to draw from a diverse pool of strategies with which to approach children and meet them at the level that they're at, especially in settings where children might be on several different levels and you have to kind of be agile as a practitioner. So I think that suggests something given the size of the Thrive sample, and that was a significant correlation between teaching strategies and child outcomes. I don't think it's necessarily a measure of a practitioner, but it's possibly a measure of whether or not a practitioner has been equipped to be responsive with their teaching strategies.
And perhaps it speaks to what someone raised now about also the duration of the training. Because, the depth of thinking, etc., and questioning to be able to connect with a child is something that when you look at some of these NQF trainings that take 2 weeks and then 2 weeks, there's no way that you can actually learn that. So maybe, there's something in the future around the correlation of the structure of your ECD practitioner programs and the depth of, like you say, the pool of knowledge and strategies that practitioners have. Okay, no, it's very helpful. So I'm just sitting here listening. So thank you very much.
Thanks. That's a great question. We are running out of time very quick.
Just
Sorry,
quickly
yes?
add, mentoring and support is also very important because if you just give people a theoretical knowledge, they won't be able to translate that into practice.
Absolutely. And I think actually, because I work mainly with primary school teachers, I think sometimes the mentoring and support is actually more useful than just the theory. It's there where we actually learn, at the. Thank you. Thank you.
Thank you. Thanks, Mildred. We are fast running out of time, which is often the case with these webinars. We only have an hour. So I'm going to ask, there's one last question that I think is actually a really good question. Colleen, would you mind just unmuting and asking the last question before we draw to a close?
Hi, good morning, everybody. So my question was just around, and I might have misheard that practitioners are not assessing children correctly. My concern is that are we then missing children with learning challenges if they're not able to assess them, the atypical child? Does your training program cover that as well? I think a lot of the comments that were made also is that the training that is being rolled out is not sufficient to equip our practitioners with this knowledge. So that's a great concern for me because we have a range of children now presenting. I can just speak from my own experience that I have children at my school on the spectrum, and we have an OT and a speech therapist working here. And my OT just told me this morning that we have a child with balance problems that was diagnosed at a conference that you went to. And how are we missing this? This child always presented as clumsy and awkward, always wanted to sleep and all of that. And we flagged her and we asked the parents to have her assessed, and she was. And the OT did a case study on her. And when she came back now, she told me that there are so many challenges. And I was just thinking that when I looked at a clinic card, they ticked all the boxes at 12 months that she was picking up between the pincer grip. And I just thought this was crazy. So how are we assessing our children generally at our clinics, at our schools? Are we missing our children? And that's just my concern at the moment. Thank you for allowing me to share that.
Thanks, Colleen. I want to point out that with the ELOM assessments, the child outcome assessments, they are not designed to diagnose or pick up on any developmental delays. And when an assessor begins an assessment, if there's an indication that there might be a developmental delay per the WHO's screening indicators, we stop that assessment and we notify the organization or the ECD center about that this is possibly something to look at, that a delay might be indicated. So the ELOM tools are not designed as diagnostic tools. They work best as population level tools, and they wouldn't be able to give detailed diagnostic information on one child, but there are indicators built in that help us identify and point to where there are potential issues, and we notify organizations. Mildred.
So just at Ikamva Labantu, what we do is we introduce practitioners to a basic understanding of developmental delay. And we've got a health team that's built a relationship with the therapists at the Khayelitsha Hospital. So once a quarter, we have special assessment clinics where children with potential developmental delays then are fully assessed by these professionals and then referred into the system. Yeah. Thank you.
Thanks, Barbara. I know that there are so many more questions coming up. What I'd like to ask, Terry, Barbara, Mildred, if you wouldn't mind putting your email addresses in the chat. So if people have follow-up questions or they'd like to connect with you further, if they can use that route to contact you, because we are unfortunately out of time. This happens every time. Which is why we have these quite regularly, because there's a lot that kind of arises in the discussion from your experiences in the different programs in which you work, and the different monitoring and evaluation tools that you use in your own programs. So I want to draw this to a close. I'd like to thank Terry from Thusanang and Mildred and Barbara from Ikamva for all of the time that you put into this. I know that it's a particularly busy time of the year. So I'm really, really grateful for the work that you put into these presentations and for the thought that you put into your engagement with the ELOM tools and being so willing to share it with this community of ELOM users and partners. So thank you very much. I'd also like to thank everyone who made time to attend. I know that this is a weird week kind of cut in the middle, and also like a very, very busy time in our sector, as I'm sure you're all experiencing. So thank you so much for engaging meaningfully with the presentations and for asking questions, and for answering questions and sharing your own experiences. I really appreciate it. Please, when I close the webinar, please stay online in your browser. There'll be a feedback form that pops up. Please do submit feedback. We really value hearing from you about what you would like to hear more from in this webinar series, so that it isn't kind of just another hour that you're spending in a Zoom call. So please give us feedback on this, and feel free to suggest webinar topics if you have questions that you feel we might not have spent enough time on. Our next webinar is in November. It's going to be the last one of the year, and it's going to be on evaluating program effectiveness, which I think is a really kind of topical, given the time of the year that we're at. It's a very topical one. So we'll see you again in mid-November for the last of the 2025 series of ELOM in Practice webinars. Thanks once again, everyone, for joining us. And yeah, we'll see you in November.
Thank you.
Thank you. Bye.
Thank you.
Bye-bye.
Bye.